How often should you do an Epley maneuver to treat your ear crystals? My name's Amy Moore. I'm a vestibular physical therapist, which means I treat conditions such as inner ear crystals, also known as BPPV. This is part 12 of my BPPV series. If you see a question on the screen you need answered, go to my profile and click on my BPPV playlist and select the corresponding part. So how often should you be doing these ear clearing maneuvers to get these little crystals out of your semicircular canals? There's only one answer, and that's only when you need to get inner ear crystals out of your semicircular canals. BPPV is an abnormal occurrence. You should not have free-floating inner ear crystals just free-floating in your inner ears at any given time. In fact, if it does happen, trust me, you'll know. Symptoms associated with BPPV that might make you think your semicircular canals have free-floating crystals in them is a sudden and severe onset of spinning style dizziness. You may feel that you're spinning or the room is spinning. Those spinning spells will come on with head movements such as bending over, looking up, lying down into bed, or rolling over in bed. And they will only last about 10 to 30 seconds with each head movement if you keep your head still after the movement. If you develop these symptoms and you get tested by a doctor, or you test yourself at home, something I taught you in part 6 of this series, and you test positively for BPPV, that's what indicates that you need to do a maneuver. The only use for a maneuver, I repeat, only, is to flush existing crystals out of the canal. It does not prevent future symptoms from occurring or future recurrences, and it does not treat any of the other symptoms associated with BPPV. If you test positively for BPPV, you should do a maneuver and retest again. Retesting can be immediate if you can tolerate that. It can be an hour later or a day later. But each time you do a maneuver, you should be testing in between to see if you're still positive. If the test is positive for BPPV, you can continue doing maneuvers. I recommend doing no more than 3 times on your own before going to see a professional. And if you're testing negatively for BPPV, or if you're not sure, you should not do a maneuver. And that is my final answer. If you have more questions or if you enjoy content about dizziness, please hit that follow button.